Hello and welcome to the Business Talk podcast. I am your host Deepak. I am delighted to welcome Dr. Alexios Mentis to our podcast. Dr. Alexios is a distinguished expert in genomics and precision medicine with over a decade of experience in clinical and public health research. Currently serving as a senior scientific officer at BGI Group, a global leader in the field, he has been at forefront of advancing genomic science to improve human health and well-being. Dr. Alexios holds an MD from the National and Kapodistrian University of Athens, a PhD in neurogenetics from the Pasteur Hellenic Institute, and an MHP in infectious disease epidemiology from the National School of Public Health. Additionally, he is an alumnus of Johns Hopkins University and has earned professional certifications in clinical pharmacology, drug development, and regulation from Tufts University, as well as digital health business from Columbia University. With a prolific publication record of over 90 peer-reviewed articles in leading journals and numerous presentations at international conferences, Dr. Alexios has earned widespread recognition for his contributions. His work continues to bridge the gap between genomic research and practice applications, shaping the future of public health and precision medicine. In this episode, Dr. Alexios Mentis will provide valuable insights from his research, the role of genomic data in shaping public health policies. Dr. Alexios Mentis, it is truly a pleasure to have you with us today.
The pleasure is mine to be on this business talk and to contribute to the continuous dialogue that you're trying to foster between India and other countries. So thank you so much for the kind invitation.
Yeah, thank you, Doctor. Uh, can you start by explaining what genomic data is and its relevance to public health?
Sure, I would agree with the people in Silicon Valley that the time we're living are exponential and the best are yet to come. So with that in mind, I think genomic revolution has already started and it's going to uh, flourish so many rewards ahead of us in terms of its data. But let us start with the basic first. So genomic data actually refer to the complete set of genetic material that can be found within an organism, which is typically encoded as what we know nowadays as DNA. So genomic data include genes that carry instructions for biological functions, for instance, how to produce proteins, as well as these regions of the DNA that would not code for proteins, but would instead regulate gene expression. And while genomic data tend to be an issue that was part of molecular biologists' jobs. Nowadays, we understand that genomic data are very relevant to public health in enabling a deeper through enabling a deeper understanding of disease mechanisms, identifying at risk populations, and as well as guiding the development of targeted therapies as well as preventive measures. For instance, genomics can predict the genetic predisposition to chronic diseases such as diabetes or cancer, which are two diseases of public health importance, so allowing interventions before symptoms arise.
How is genetic information being integrated into national and international health guidelines?
Well, genetic information was not considered pivotal until some decades ago, and certainly it was not part of the agenda before the Global Human Genome Project. Nowadays, there are several ways through which genetic information is being incorporated into health guidelines. Just to give you some examples, and right now many countries have started to recommend genetic screening for conditions like a familial breast and ovarian cancer that are due to BRCA1, BRCA2 mutations, and to other mutations. So we can see that genomics data can drive screening programs. There's also an initiative in England regarding genomics-based neonatal screening, so that the young generation of newborns can know and their parents can learn to which diseases are predisposed. And this will have positive effects not only on the individuals, but also on the health system and the planning for resources allocation. Another example in which genetic information is integrated national guidelines refers to the now very well discussed COVID-19 pandemic. For example, organizations like the World Health Organization try to consistently establish frameworks for genomic surveillance of infectious diseases based on genomic information. And this approach is one that enables countries to align their public health policies with international standards. Last, a third example of genetic information integration to these guidelines is the case of pharmacogenetics. Now, many clinical guidelines want to include genetic testing for drug efficacy and safety. For example, testing for certain variants of the cytochrome in order to prescribe or not certain medications such as clopidogrel. So we can see overall that there are indeed some very bold cases in which genetic information is integrated into international public health guidelines.
Dr. Mentis, what is the role of genomic data in population screening programs?
So we've already mentioned one example regarding neonatal screening. I think we live in the so-called 4P medicine era, which is predictive, preventive, prognostic, and participatory. And with that in mind, genomic data are going to affect the so-called precision screening, so we can provide tailored screening based on certain genetic risk factors, such as the polygenic risk scores that are now becoming increasingly available for several diseases, such as heart diseases, predisposition to diabetes, predisposition to cancer, predisposition to stroke, and so on. Then genomic data at a larger scale, the population scale, will allow predictive analytics, for example, identifying individuals who are predisposed to diseases like type 2 diabetes, and that will in turn allow lifestyle or medical interventions in order to delay onset. And last, genomic data will allow carrier screening, for example, to detect carriers of certain major and clinically very severe diseases like Gaucher disease, and so on, and other recessive genetic disorders, which will allow informed decisions for families. So all these applications will improve the efficiency and effectiveness of existing screening programs. They will reduce costs for the health systems, and they will maximize the public health impact.
How do policymakers decide which populations to target and for what conditions?
My feeling is that there was a reluctancy of policymakers to provide genomics guided information in the past, perhaps because the broader implications of genomics were neglected to a more or less extent. However, I think in our era, policymakers can use a combination of genomic data, epidemiological data, and cost-benefit analysis in order to determine priorities. For example, the high prevalence of certain genetic conditions like sickle cell anemia in African populations, or other genetic conditions in specific ethnic groups, may warrant targeted screening in order to address these epidemiological needs. Policymakers can also decide based on cost effectiveness. For example, if we aim to target conditions where early detection would significantly reduce healthcare costs or would improve clinical outcomes, such as in hereditary forms of cancer, that is going to certainly reduce the burden of the healthcare system. And another criteria that we should not neglect during policy making related decisions are the ethical and cultural considerations. For example, genomic screening might lead to stigmatization or to discrimination against specific racial or ethnic groups. So it's very vital that genetic information is kept as much private as possible.
What are the ethical challenges of using genomic data in public health policies?
Well, most people have thought about the issues of privacy and how we can keep our genetic information private and not be in the hands of people who might lead to actions like bioterrorism or to certain insurance companies who might deny us signing in contract with them or to potential employers. But I think the ethical, or as we say, the ELSI, the ethical, legal and societal implications and challenges of using genomics are much broader. There are four principles in bioethics which are developed since the lectures of Professor Beeson from the United States, which is the justice, the autonomy, the beneficence, and the non-maleficence. And certainly genomics should keep the genomics community should keep their eye focused on ensuring that all these guidelines, bioethics guidelines, are kept into enforcement. So in other words, the key ethical challenges would include equity. For example, we should make sure that genomics is for all, as BGI would say that, for example, no disparities in access to genomic testing and related healthcare services take place in the future. Then, as I mentioned before, we should ensure that no discrimination based on genetic information is performed either to insurance or to employment. A third issue has to do with the autonomy and, for example, the notion of informed consent. So we must ensure that participants should be able to understand the implication of genomic research, especially with regards to incidental findings. And by the phrase incidental findings, we mean the genetic information that becomes that is not associated with the disease we're checking for in the DNA, but becomes available as a by-side knowledge of sequencing the genome. As I said before, we need to ensure privacy and to protect individual genomic data for either misuse or unauthorized access. So all these challenges should be addressed in order to provide robust ethical frameworks to maintain strict and rigorous data protection laws, and as well as to promote transparent public engagements. Otherwise, the broader the society at large would lose its confidence to genomics, and then the societal risks would be higher.
Dr. Mentis, what infrastructure and training are necessary to support integration of genomic data into public health systems?
Well, that's an excellent question, and many thanks for raising it. So there are certainly several critical requirements. To begin with, for example, we need high throughput sequencing facilities with excellent quality control systems. So we can't perform genetics unless we have genomic labs that really do the hands-on work. Genomics has been so much driven by technology that right now we can't do otherwise. As a corollary, we need some strong bioinformatics expertise. So that means we need skilled professionals who are either biologists or computer scientists and who can really program, who have knowledge of programming and who are able to analyze and interpret genomic data. The third step is we need to to make sure that genomic data are stored appropriately, effectively, and in a secure way. So we need to develop secure systems for storing and sharing sensitive genomic data in a rather encrypted manner that will not be, for example, affected by any potential hacking approaches. Moving forward, we need to integrate further and further the education about genomics and its importance to general practitioners, to healthcare providers, on interpreting and applying genomics findings into clinical and public health contexts. And to this voice, I would really like to highlight the importance of all countries collaborated by WHO to work on promoting the residency, the medical residency of clinical genetics. For example, in my native place in Greece, unfortunately, some unethical attitudes have not allowed the genomics residency to be able to become available to patients. And this is a major training-related obstacles against promoting genomics.
What challenges do policymakers face when implementing genomic research finding in health policies?
So that's perhaps a question that's really the crux of bridging research to innovation and translating evidence to practice. And many thanks for making this question. Well, there are several challenges that need to be addressed. So, for example, first of all, policymakers should develop at least a fundamental genomics literacy. They should understand what DNA is, why it's important, and I'm not talking only about resource rich settings. I'm also talking about resource poor settings. I'm talking even about states and countries that are like, let's say, in islands of the Pacific. So the policymakers will need to understand at least what is DNA and what is genomics. Then they need to appreciate that genomic data are quite complex, and that translating genomic findings into actionable policies requires many stakeholders in the field. It requires an interdisciplinary expertise, and it's certainly and it's certainly and not in 1 month. So a second challenge has to do with the high costs of sequencing and related technologies, which can limit implementation and which can serve as a major cost barrier. Then there's also the fear of and in the population. So there's several misconceptions and fears about genomics that can hinder the acceptance and adoptions. So assisting genomics, assisting the population into having a very good and widely accepted public perception of genomics is very crucial. Another challenge that we should not forget has to do with the regulatory hurdles. So balancing innovation with ethical and legal compliance, especially in settings like the EU, where there's a lot of regulation and laws about personal data, can slow the progress of genomics. So my suggestion would be that countries, at least those countries that have the funding to do so, to create some genomics policy fellows that really can assist the states into bringing the two sectors together. I mean, the scientific community that produces the genomic data, the medical and the public health community that analyzes this data into medical and public health settings, and then the policymakers that need this information to guide their national policies.
Doctor, how do global health organizations collaborate to address disparities in access to genomic technologies?
Well, I think there have some very exciting global collaborations over the last decades and so on. For example, there's some funding initiatives like the Global Alliance for Genomics and Health that work to democratize access to genomic tools. There are also some several efforts of technology transferred by providing low-income countries with access to genomic equipment and expertise. And then there's also capacity building that relates to training local scientists and healthcare workers in genomics research and applications. I think many countries like United States, Canada, Switzerland, France, Germany, and United Kingdom have trained several people from countries like Asia, um, Africa, and Southern America and their labs. And I think all these current or past trainees can really serve as, let's say, as the people who are going to transfer this knowledge into resourceful settings. I would say India is expected, in my personal opinion, to be one of the leaders and perhaps the biggest leader in the field of genomics. And I would like, by this opportunity of this interview, to make an official proposal to India to create a national genomics institute that will try to sequence representative samples for the 1.55 billion people from India, and that's going really to create a bold genomic revolution to India.
How do you envision the role of genomic data evolving in public health policies over the next decade?
I've been consistently thinking about this question on my own.
Yeah.
I think we've experienced several years of pandemic. So the first thing that comes to mind it's how genomics are going to assist in real-time disease monitoring. For example, the combination of genomics with artificial intelligence is going to create some artificial intelligence integrated genomic surveillance for rapid response to outbreaks. And I would like to add not only rapid response to outbreaks, but also a rapid detection of potential outbreaks. I would give you a certain example of right now. There are certain next generation sequencing approaches that can really sequence microbes and in particular viruses in the field, in the forest, in Africa, or whatever, and that really can allow, just like being a USB, so small sequencing machines, just like how USB stick to analyze the DNA and then send this information for phylogenetic bioinformatics phylogenetic analysis and then be able to prevent. So I think the next decade is going to be extremely exciting in that regard. Then the second field has to do not so much with public health only diagnostics, but also with gene therapies. I think the next decade is going to be the decade of gene therapies, where we will see many clinical trials currently in phase 1, 2, or 3, providing fruitful results and support and allowing broader access to revolution treatments like the CRISPR genome editing based cures. And last, I think genomic data will allow personalized prevention, both at the individual and at the population level. We would live in an era, let's say, of what's called a high definition medicine. We live in an era where we'll have so much knowledge about our genome that we will able to make much more informed health decisions.
Thank you, Dr. Alexios Mentis, for joining us and sharing your invaluable expertise on the role of genomic data in shaping public health policies. Your insights into how genomic research is transforming public health from population screening to resource allocation have truly deepened our understanding of this critical field. Until next time, stay curious and let's continue exploring the intersection of science, health, and policy. Thank you and take care.
Thank you so much for having provided me these opportunities. As many colleagues in my field say, the best are yet to come, and I look forward to joining further talks with you on how India can be the leader in the field of genomics and public health. Thank you so much.
Thank you.